Thank you so much, Nompumelelo. This is Your Money on Market Sense. A little later, I'll be bringing you SME on Point. My name is Diabosito. Medical experts say the practice by medical aids to force members to pay for certain procedures or treatment out of their pocket is unethical. This follows a decision by the Council for Medical Schemes to introduce regulations to curb the practice of co-payment often paid by medical aid members.
South Africa has one of the most expensive private healthcare in the world, and with the country's public healthcare increasingly under-resourced and overcrowded, private healthcare cover has become a viable option for those who can afford. However, the majority of the population who do not receive any form of medical aid subsidy from their employer find it difficult to afford their high medical aid costs. As a result, some opt for cheaper alternatives like medical insurance, but a more affordable cover can mean fewer benefits.
With the affordability issues, you need to then realize that your benefits are very different. Typically in health insurance covers, you actually find that your hospital cover would be limited. A lot of the products have almost a 3,000 a day limitation with a maximum of 21 days. So they tend to be limited to about 150,000 Rand in terms of what their maximum is in terms of payout. While medical schemes and just the own ProfMed, which I'm involved in, has just paid a claim that was over 8 million Rand, and that was a COVID-related admission. So you must understand that with more affordable cover usually means far limited benefit.
The Council for Medical Scheme regulates medical aid to ensure that consumers are treated fairly. Currently, medical aid members are compelled to pay more for a medical treatment or medicine if it falls outside their scheme's network providers. Last month, the Council published guidelines regarding co-payments paid by medical aid members. It says that medical aid schemes found to be charging excessive co-payments will be engaging in undesirable business practices. The Council says that co-payment limits the number of selected medical providers that can be used.
What a co-payment is that you are co-insuring yourself with the medical aid for the procedure of going to hospital. Can you explain that to me? I pay medical aid, so I have hospital cover. Why do I have to co-insure myself by any amount? I think it's unfair and wrong.
There's no doubt that there are some co-payments that don't clearly reflect the difference in both the price and the quality of service that a person would receive from what is called a network provider or a designated service provider. Often the schemes will go out into the market and they'll put together or they'll contract a certain provider based on both volumes, pricing, and quality of service, and then get a discount for that. So it does mean that premiums are usually a little cheaper if you have a designated service provider.
In terms of the new rules, medical schemes have to offer prescribed minimum benefits. This means they must pay for your hospitalization, cover for you for any chronic illnesses and medication. It also means that patients no longer have to pay for any co-payments in order to receive these benefits. But medical insurance is governed by medical short-term and long-term insurance, and it does not have to offer prescribed minimum benefits to its members.
I do not think that medical insurance could be a replacement of medical aid, and for one very simple reason. Should you have a major car accident, God forbid, and there's continuous care that is needed post-surgery and post-op, the limit that your insurance has is going to run out very quickly.
The Council for Medical Schemes intends to publish guidelines compelling the medical aid industry to implement the new regulations before the end of September this year, and it's hoped that this will go a long way to help curb the high cost of private healthcare in the country. Naledi Matlapeng, SABC News, Johannesburg.